a doctor.
I'd always promised my mother that she would come and live with me. Okay, I promised that I'd look after whatever. I don't think she or I ever thought that it would actually come to that, but it was a promise I'd made. The first time when I walked into the lounge and she looked at me and she said, "Can you call my daughter?" Okay, that's probably your worst. Really, we've been through a road that I wouldn't wish on anybody the last 2 years, especially the first year. Would I do it again? Yes, I would do it again. There's wonderful support out there. You've got Alzheimer's South Africa, you've got Dementia South Africa, you've got wonderful support groups. There's so many people just sitting by waiting to help you, and you must ask for help. And the thing is that a carer tries to take on everything as I did. You just can't do it. You've got to involve family, you've got to involve friends or hired help. But there's no ways that you can do it on your own, because you're going to burn out, and the person that's actually going to suffer the most is the person that you're caring for.
I'm a doctor.
Heartfelt advice: go for help, don't do it alone. Patients living with Alzheimer's can have the disease for up to 20 years, which is an almost unbearable burden for the caregiver. Azelle, how common is Alzheimer's?
Alzheimer's is actually very common in older people, and the older a person gets, the more likely it is that he or she will get Alzheimer's disease. When you look at numbers, we would usually say that roughly, when you look at the age group over 65, 1 in 10 people will have Alzheimer's disease, where the number would increase. And in the age group over 85, between 40 and 50% of people will have Alzheimer's disease. So that's actually a big number of people. Yeah.
So the difference between aging, normal aging, and Alzheimer's, how do we tell the difference?
I think with Alzheimer's disease, we see that people present with short-term memory problems. That's the most important sign of Alzheimer's disease. They will remember events from long ago, even their childhood, they can remember very well usually, but recent events they would struggle with. Often they also become disorientated. They sometimes get lost when driving, sometimes in shopping centres they would get lost, not know what the day or the date is, and that would become quite noticeable to the family. Other changes that's not normal that we see with Alzheimer's disease would be personality changes. Often people become more agitated and irritable, and the problem is they often don't have the insight themselves. It's the family, who will notice. And the patient would absolutely deny that there's a problem. So it's sometimes quite difficult to get them to come and be diagnosed. We know if we diagnose Alzheimer's disease, there's actually quite a few things we can do about it. We've got medication on the market these days, specifically for Alzheimer's disease.
And what does that medication do? Retard the progression, or does it actually preserve normal functioning?
The medication cannot cure the illness, so people will not recover. They will not remember like they did before, but it will definitely slow down the progression of the illness. And people often ask us, is it really worth it? And we see in our practice that it is, because if you slow down progression, quality of life improves, the quality of life of the caregiver improves. So I really think it's worth it. And we also have other medications on the market to treat the behavioural symptoms. If there's restlessness, insomnia, agitation, you can use medication to treat that, which also, again, helps the caregiver to have a better quality of life.
What about prevention? I think that's a big question everyone's asking. Can I prevent getting Alzheimer's?
We would generally recommend that people lead a healthy lifestyle. There's not one specific thing that you can do to prevent Alzheimer's. Unfortunately, up to date, we cannot predict who will get Alzheimer's and who won't, and we cannot guarantee that somebody will not get Alzheimer's disease. We would say lead a healthy lifestyle. Exercise, don't smoke, don't overuse alcohol or any other drugs, and also check medically that you're well. Keep cholesterol, blood pressure, all those things under control. That's the most we can do to protect the brain.
And what about stimulating the brain?
That's
Crosswords,
also
reading,
yes. We always recommend that. That is very good. Even when people have the diagnosis, we would recommend that, because that also improves quality of life and slows down the progression of the illness to keep the brain active.
It's a disease that more than any other disease affects family and caregivers. So your treatment almost is aimed at them more than the person with Alzheimer's. I mean, what kind of hope could you give to families?
I think families should realize that there's something that we can do. I think if a patient is diagnosed, don't think this is the end of the road, there's nothing we can do. We really aim to improve the quality of lives of the patients and the caregivers. It's also extremely important to look after caregivers. That's something I haven't mentioned. But when you see a caregiver, because they often become depressed, they often become anxious because it's such a burden on them to look after a patient all the time. So it's important to just keep an eye out for that as well, to make sure that your caregiver is actually well.
Thanks, Azelle. So care of the caregiver, an essential part in treating Alzheimer's. Early diagnosis and treatment with cost-effective medication preserves to a degree the functioning of the patient and is ultimately a gift of grace for the caregiver who would otherwise have to bear an almost unbearable burden. So start sooner rather than later and get them to a doctor. Justine has got a recipe for boosting mind function so you can make the most of your brain while you still have it.
Cipla will make it better.